Hi, everybody. Today I mentioned that we are going to start a new chapter. So we just finished safety, and now we're going to cover history of healthcare, which I think I mentioned on Friday. Some students love history, some don't. I think this is somewhat interesting, though, because, yeah, it's interesting to see kind of how far we've come. So this presentation is going to be broken up into two different lectures. So you'll have one lecture today, and then you will have another lecture this week. So I haven't decided what day that will be. It might be on Tuesday, so tomorrow, but I will let you know. So same thing with your other notes, just making sure that you're writing these notes on lined paper. You're titling it History in Healthcare or History and Trends in Healthcare, and then just making sure too that you are writing your name clearly at the top. And these notes are also due by the end of the period. Feel free to reach out if you are having any tech issues. So yeah, like I mentioned, healthcare has obviously changed over the years. In the primitive times, so way back in the day, there was this common belief that disease and illness was caused by evil spirits. So anytime you see this medical or this abbreviation right here, TX, that means treatment. It's a medical abbreviation. So basically, back in the day, this is like, I would say early 10s, so like 1180, that sort of thing, or even before that. They believed that you needed to get rid of these evil spirits, and then that would cure your disease and illness. So obviously, this didn't work because we now know that disease is not caused by evil spirits. I'm sure there are people that still believe this, but in general, Western medicine, we know that disease is not caused by evil spirits. So treatments back then were things that we would never do today. So they would do sometimes dissection. So dissection is when you actually cut into a human or an animal. So they would try to maybe dissect a body part, thinking that that would help. But if you're dissecting something, maybe you're removing it, then obviously they don't have that body part anymore. You run the risk of infection. So a lot of people ended up dying during this time because of just the misinformation that they thought that disease was caused by this sort of thing. Also, they would do things like bloodletting, which I think we talked about when we went over leeches for our opening activity today. But if you forget, bloodletting is when basically you cut into someone and you just allow them to bleed. And so for them, that was a way for them to release those evil spirits. But when you're losing, large amounts of blood, obviously that can become very dangerous to a person's health, and they can die. So again, old beliefs that we don't necessarily use anymore today. Egyptians, they were the first people to actually record health records. And so these health records don't look anything like they are today. If you know anybody that works in healthcare or know anything about health records, it's not the most interesting thing. But now they're recorded obviously via computer. They're emergency medical records, so EMR. I know that you ever go to the hospital or the doctor's office, you might see somebody typing things up. That's someone charting. So just know that originally they were first on stone, and then obviously they've progressed to what they are today. Chinese. So the Chinese were one of the first cultures to really believe in a more holistic approach to your body. So they believed that if you treated the spirit, and so if you cured the spirit, you would nourish the body. And so they had this connection that basically your mind, body, and soul were all interwoven. And because of that, we still use that today. I'm a huge proponent on knowing that your mental health plays a huge role in your immune response, your ability to heal. So they're one of the first cultures that actually believed that, and I think it is true. Studies show even today that if your mental health is down, let's say you're depressed, you're stressed out, you have anxiety, you're more likely. And it's not 100% accurate, but you are more likely to become sick. So that's why, especially right now, we'll talk about this more, but with the pandemic, I know it's super stressful for high school students. It's stressful for everyone. It's stressful for me. That's why it's so important for you guys to just find something to do that de-stresses so that you're not weakening your immune system or exercising, that sort of thing. And then the Chinese were the first to basically use morphine. So morphine is derived from the poppy plant. Morphine is a painkiller. And so they basically use that to help aid with healing, because if you're in pain, you're obviously going to have issues with your healing process. Chinese cupping. Chinese cupping is something that has been around for hundreds of years. It is something that's just kind of recently taken off, I would say, over in America. I have a Chinese cupping set in my training room, but the purpose of it, and there's different theories, but the purpose of it is to promote more blood flow to the area. So if you have, let's say, like tension in your muscles, so you can see the swimmer, she probably has a really tight back, like you have several muscles in your back, so she probably has a lot of muscles in her back that are pretty tense. And so cupping can help by bringing in more blood flow. More blood flow basically loosens up the tissue. It helps aid in healing. And so then that can also release tension. But there's different reasons why people use cupping. The primary reason I use it in my training room is, yes, to help loosen muscles, but it can also help to, again, if you have a spot that maybe is not getting enough blood flow, it can help bring that in, warm up the tissue, and allow the tissue to heal a little bit more quickly. We're talking about Chinese medicine. So Chinese medicine falls under the umbrella of holistic medicine. You think of traditional medicine as like a primary care physician that's prescribing you medication. Those who do holistic medicine do not believe, it's not that they don't believe in that, they just practice in a different way. I think that you can get the best of both worlds. You can see traditional medicine doctor and then also seeing any of these practitioners. So you have your Chinese medicine, acupuncturist would be one of those. A chiropractor, a lot of people don't know this, but a chiropractor is actually a alternative medical career. So some people get confused with chiropractors. They assume chiropractors are doctors, but they're not doctors in the same way as a physician. So like they can't prescribe medication. I know some try to, but you're not supposed to. But yes, chiropractors are great. If you're having, back pain, oftentimes it can be due to maybe a vertebrae out of alignment. So a chiropractor can adjust you and then you have instant relief. You have your hypnotists. So this is also another type of alternative medicine where it's, I would say, used more primarily for like psychological issues, but it can be for other things too. But the hypnotist will then put you into hypnosis. And they believe that basically when you're under hypnosis, then you're able to really uncover maybe some of the things that have been too traumatic for you to actually bring into your everyday life. And then you have naturopaths. So this is another practitioner that's non-traditional, and they believe that a lot of medical conditions can be treated with maybe a healthy diet. They can be treated with herbal medicine, things like that. And so, again, this is my personal opinion. I think you can get the best of both. So you can have a physician that's telling you one thing. You can see a physical therapist for pain. You can see I'm considered more traditional too, so athletic trainer. But then you can also lean on some of these alternative practices to kind of help with that. I always ask, like students will ask me, do you think I should see an acupuncturist for this, or should I go get acupuncture? I always tell them, hey, if it's not going to make the injury worse, then fine. I don't know how much of a difference it will make, but if you believe it helps you, especially with sports and athletes, a lot of it is psychological. So if they think it works or if it does work, then yeah, it shouldn't be an issue. So what I was trying to get at though is a lot of people think that these professions are not real medicine. There are physicians that believe that all of that stuff doesn't work. But if you are someone that's working in the medical field, you need to be non-judgmental to this. So you know that patients do have a right to choose their treatment. You need to be aware of this. There are people who are diagnosed with cancer every day and they choose not to do chemotherapy, which was traditional treatment, and they choose to do, they could be maybe seeing an acupuncturist or a naturopath, taking medicine or taking herbal medicines, things like that, versus seeing a primary care physician or oncologist who is your cancer physician and treating them via the more traditional route. And again, just being aware of this as a healthcare worker. All right, so we're going to get into pretty much the the original person, the OG, I guess, of medicine. So this is Hippocrates. He is known as the father of medicine. He basically established the Hippocratic Oath. So if you know anything of it, doctors still take this oath, and the oath just basically means that they're going to perform their job at the best of their abilities. They're going to make sure that they're taking their patients' like best interests, that sort of thing. But he was a very first person to believe basically that disease was not caused by these spirits or demons like people thought in the past, but that they could be caused by other things. So he believed that if you had a good diet and if you were clean, then that would help prevent disease, which that is something too to this day we still use. I think there is a lot of push right now, and I'm not trying to be political. I mean, this whole thing with COVID has become political, but there's a lot of push right now of how you need to wear a face mask, how you need to wash your hands, vaccine. And I'm not anti-vax, but there's not a lot of talk about what you should also be doing to build up your immunity. So eating healthy, exercising, trying to not let every little thing stress you out. All of those things are just as important as you taking a vaccine, as you wearing a mask, as you washing your hands. So like, think of that too. If you're not really focusing on your diet right now, I totally understand you're in high school. You don't buy probably your own groceries, that sort of thing. So that's kind of out of your control, but try to do something with your body every day, move, try to find something that helps you to de-stress, because that's also just as important as modern medicine. Anyways, during the Dark and Middle Ages, there was a huge, and you might have heard about this in your history class if you've taken world history, but there was what was called the bubonic plague. And so this happened in the 1300s, and about 75% of people in Europe and Asia actually died, which is a ton of people. I don't remember the exact number. I know it was at least a couple million, which for them, there obviously wasn't as big of a population as we have today. So a lot of that had to do with cleanliness because the rats were the carriers and there wasn't a lot of hygiene control back then. So I think if something similar had obviously happened today, it wouldn't result in the same amount of deaths. All right, last thing we're going to talk about today are epidemics and pandemics. So I would say before COVID-19 occurred, and my students previous years had no clue what these words were. Just know that an epidemic is when you have a disease that's spreading over a smaller region of people. So example of this is coronavirus. When it first started in Wuhan, China, and it was just isolated in Wuhan, China, that was when it was just an epidemic. However, once it transferred over to multiple countries, overseas, things like that, that's when it became a pandemic. So typhoid is an example of this. Typhoid is usually in third world countries. You typically don't see it. In first world countries, it's not something that the whole world is infected with. Avian flu, which was also known as the H5N1 virus. This was also just an epidemic in Asia. I would say that is a big reason why at the beginning of coronavirus, you saw people in Asian countries wearing masks, things like that. And a lot of people in the US were kind of like, what? Wearing a mask doesn't make sense. For them, they were already prepared for that because they've already dealt with epidemics. Whereas over here, we haven't really had that issue up until recently with COVID-19. Viruses in general, we'll talk about this more when we get into how infection spreads, but viruses can mutate. And that's a big reason why things can spread so quickly. And like I said, again, we'll talk about this more with infection and how it spreads. But if you have one person that's infected and that virus is able to mutate, that person can get sick. And then let's say they recover, they can still get that virus. It's just going to be a different mutation of it. So think like the flu. Flu, you can get a flu shot. But it's only going to protect you from certain strains of it because that virus continues to mutate. And that's kind of stuff that they're starting to study right now with COVID-19. But just keeping in mind, the reason why viruses are harder to control is just that they mutate so quickly and they can exchange genetic information, that sort of thing. All right, so the pandemic. So this is something I'm sure you guys are somewhat familiar with, but a pandemic is an outbreak of disease over a wide geographic area. So pandemics are typically things that infect whole continents. The world right now, obviously, with COVID-19. But yeah, just knowing that influenza is a type of pandemic that has occurred. It occurs annually. The flu doesn't kill people as much as COVID-19 has, but I think a lot of that too has to do with we know how to treat for the flu. We're not really 100% certain how to treat COVID-19. So I think once we find not only the vaccination, that sort of thing, and again, I'm not trying to be political, but just I'm trying to think scientifically. But it's not the vaccination so much that we really need to focus on. It's how are we going to treat it if someone were to become infected? So once we find a proper treatment, and that's where, like, if you're following the news at all, like that hydroxychloroquine conversation is still like not certain whether or not that is an adequate treatment. But anyways, if a pandemic were to occur, which we have one right now, normally when I go over this, most people are just like, what? This makes no sense. Why are you talking about this? Obviously, right now, this is very relative because we're learning about it or we're dealing with it daily. So, with COVID-19 or any pandemic, I'm not just trying to focus on COVID-19, government needs to have plans for this. So, there needs to be education to the public, which is why you will see probably anywhere that you go signs saying, wash your hands, cover your mouth and nose when you cough, make sure you're wearing face masks, social distance, that sort of thing. That education component is super important. However, there's been, a little bit of a loss with all of that because this whole thing has been politicized. Vaccine production is important. And if you look at it from, again, I'm not trying to promote vaccines, but if you look at it from a scientific, take, vaccines, if they're safe, if they're effective, you can have what is called herd immunity. I don't know if you've heard of this, but herd immunity is basically people now can't potentially get sick because they're now immune from it. So if you have more people who have immunity from it, then you obviously don't have those people spreading it. They're not going to get sick to spread it to more people. So that's kind of the idea behind that. There are antiviral drugs. So again, not going to focus on COVID-19, but if you're ever sick with the flu, there is an antiviral drug that if you take within 72 hours, it's called Tamiflu, that it can help lessen the severity of your flu symptoms, but it has to be taken within a certain period of time. And that's just because viruses can kind of affect your DNA. And so if it's too late, then it's obviously already kind of overtaken. But anyways, we'll not focus on that. Making sure that you have developing protective health measures. So again, wearing the face mask, international cooperation, super important. So at the beginning of the pandemic, the WHO, US was making sure that they were having conversations, shutting down like air travel, water travel, so the cruise ships, things like that. So that's super important because if you have countries that aren't following those guidelines, then it's obviously going to continue to pass around in different spots. All right, actually, we will stop there today. So again, today's focus wasn't on COVID-19. I was just trying to talk about things that have happened in the past. Tomorrow, we'll talk a little bit more about the history, different outbreaks that have happened previously. I just thought it would be kind of interesting to talk about what's going on now. But same as your other notes, just make sure you upload them before the end of the period. If you have any questions, feel free to reach out. And I hope you have a good rest of your day. Bye.